Hello, medical assist, or sorry, hello, medical terminology students. All right, we are now into chapter 9 of our textbook, The Nervous System. Again, this week you only have one chapter. The nervous system is definitely a complex system, even though the chapter itself may not seem too long, it's still a pretty complex system. So let's get into it. Again, I'm going to go through this pretty quickly, because you'll learn more in your smart book, and then you can use the other PowerPoint if you want to go slower. All right, taking a look at page 263 in your textbook. We have our nervous system. As you can see on here, this picture's not the greatest, but there's two different systems. We have the central nervous system and the peripheral nervous system. And in the peripheral nervous system, we've got two components, but I'll get into that. The functions you can see here, we have sensory input, motor input, evaluation and integration, homeostasis, mental activity. Our central nervous system just consists of our brain and the spinal cord, and then the peripheral nervous system is going to be all of those nerves that kind of branch off of those two areas. And you can see the peripheral nervous system, all those nerves going down like to the tips of our fingers and the tips of our toes. In the central nervous system, again, it's just the brain and the spinal cord, but in the peripheral nervous system, we have several different divisions. It kind of branches off. You can see here where we have a sensory division and a motor division. And we have, again, it breaks down again where it's visceral and somatic, but then we go to our sympathetic and our parasympathetic divisions, and that's where we get to that fight or flight syndrome, where our body will react to different stressors or crises or emergency situations, and then our nervous system kind of tells us what to do, whether we shut down, run, fight, whatever it may be. Just a little bit of information about the peripheral nervous system. You can see visceral nerves pertains to internal organs, because visceral actually has to do with internal organs, and you'll see that in the motor division. Yeah. Somatic nerves, the skin, muscle, bone, joints, you can see in somatic. In the motor division, somatic means the skeletal voluntary control. Again, this is just a brief overview. I don't need you to really pay attention to that. But let's talk about all of this information is on page 263 in more detail. But let's go to the difference between the sympathetic or the parasympathetic division and the sympathetic division, and that is on the top of page 264 in your book. So if we break it down, parasympathetic pertaining to beside together suffering. But if you look into that again, it calms, what it does is the parasympathetic actually calms the body, slowing down the heartbeat, but stimulating digestion. And then if you look at the sympathetic nervous system, it means pertaining to together suffering, but the sympathetic, that's the one that provides us for action, to fight, to figure out what we want to do. And it increases our heart rate, it increases our respiratory rate, but then it also slows down digestion. And I guess when I went to nursing school, one of the things that helped me remember that is that the sympathetic nervous system, because it increased my heart rate and increased my respiration rate, but slowed down my digestion. It meant that I've got the energy and the respiration to run away from a bear who's chasing me, but I don't need to stop to go to the bathroom. So, because you don't want to have to stop to go to the bathroom when you're, being chased by a bear. Anyway, it was just something fun that my instructor shared with me, and I'll share with you. Some other terms that you're going to see in here are afferent. So let's see what afferent is. And then we have efferent. So afferent with an A, efferent with an E, efferent to bring to, and then efferent to bring away. And that just has to do with the message along the nerve pathways, which way it goes, whether it goes out or in. So afferent is going to bring the sense in, and then efferent is going to push it away. Ganglia is the swelling. It's just that's just what it means. But and then you have a nerve neuron and a plexus. And a plexus means a braid. It's like a combination of things kind of mixed to braided together. The cells of a nervous system it's a neuron. And you can see here is a pretty big picture of a neuron. And in a neuron, it includes a cell body, axon, dendrite, synapse, and neurotransmitter. And every single one of these have different functions. But you can look at that picture on page 265. And there's a bigger picture of the actual neuron in your book. And then this here shows the neurons together and the synapse that attaches them. All right, some neuroglia. Let's take a look at some neuroglial cells. We have astrocytes, and obviously they kind of look like a star, and that's why they're called astrocytes. You can see here in the picture. Oligodendrocytes, scanty, tree-like, and the oligodendrocyte is kind of like here. And then microglia is going to be obviously micro, and then glia means glue. It's going to be right there. The following abbreviations, again, your abbreviations are going to be in the back of your book, but the BBB is a blood-brain barrier, and then CSF was going to be cerebrospinal fluid. Differentiation between the gray matter. There's two different types of brain matter. There's gray matter and white matter, and each of them have to do with just the different components within the matter. You don't need to know that for me, but it just gives you an idea. And that, if you want to learn more about that, the gray matter and the white matter, figure out. Is Sorry, guys. Trying to look to see what page that's on. It's on this page right here, but maybe not. It's in your book somewhere, and I cannot find it right now. But you guys don't have to worry about that. The brain and the cranial nerves, though. Let's get into this. There's different parts of the brain. We have the cerebrum, the cerebellum, and the brainstem. And in the cerebrum, we have our frontal, parietal, temporal, and occipital lobes. Our cerebellum is the posterior part of the brain. And then the brainstem, which is back there as well, that controls the heart and lung function. So for cerebral lobes, you can see we've got the frontal lobe. This is going to be up here. Our parietal lobe is going to be here. Our temporal lobe is going to be here. And the occipital lobe is going to be back here. And then you can see it's split down the middle where it creates two different hemispheres, your right and left side. Terminology, we've seen the term cortex before, but let's see it again. And a gyrus and a sulcus. And this just has to do with the description of if we go back, these different areas right in here in the brain. Different regions of the actual brain in here. You have your thalamus, your hypothalamus, basal nuclei, and our limbic system. Our brainstem, which we already talked about a little bit. So we have the brainstem, we have the pons, medulla oblongata, and the cerebellum. We don't have to worry about the group activities. Apologize about that. Then we go into the cranial nerves. There's 12 different cranial nerves. And I you may not be tested on these in this class, but I know for other classes like anatomy and physiology, nursing, respiratory therapy, even medical assisting, you will have to know these the 12 different cranial nerves, what they are, what their function is. There is a table on page 272 of your textbook, which actually gives you the Roman numeral of the cranial nerve, the title of the cranial nerve, and then it's going to tell you the actual what that cranial nerve does in the body, its function. So definitely take a look at that. Um, Here it says table 9-2. So these are the different cranial nerves, 1 all the way to 12. I'll let you take a look at that and do study that, but the table is a really nice table. And then we have the spinal cord. On page 274, there's a picture of the spinal cord. There are 4 different sections of the spinal cord. You have the cervical, which is up top in your neck area, and that has it's C1 through 8, then the thoracic, T1 through 12, which is going to be in the chest area, the lumbar, which is going to be in the low back area, and your sacral nerves, which is kind of like in below the low back, but kind of like in your buttock area. Disorders of the brain and the cranial nerves. So in the brain, we have dementia. This is a really, really common one. And there's different types of dementia. Dementia is what we consider an umbrella term, and then there's different forms of dementia underneath that. And Alzheimer's disease is just one form of dementia. All right, the other one is cerebrovascular accidents, CVAs, or otherwise known as strokes. And there's several different reasons for strokes. So atherosclerosis could cause a stroke, an embolism, and microangiopathy. Hemorrhagic strokes, transient ischemic attacks, otherwise known as TIAs. So term analysis, we did the abbreviations already. So CVA, you should know a cerebrovascular accident. TIA, transient ischemic attack. And then we have hemiparesis and hemiplegia. So make sure you know the difference between paresis and plegia because it does make a difference. Paresis is just going to be weakness, but paralysis means that you can't move it. It's true. I mean, the plegia means true paralysis where there's no movement, no feeling. And there's different types of plegias, and that all depends on where the injury occurred, either in the brain or in the spinal cord. So quadriplegia, quad means 4, and that has to do with all 4 limbs. Diplegia means 2. Monoplegia, 1. Paraplegia is actually going to be where the lower half is affected, and then triplegia is going to mean 3. Other brain disorders, let's take a look. We have epilepsy, narcolepsy, ataxia, post-ictical. And actually the term post-ictical actually refers to the time frame after you have a seizure where you're still having the effects of the seizure. Encephalitis, cerebral edema, and then there's syncope. In addition, we have traumatic brain injuries that can be caused by These different areas can be caused by contusion, a concussion, impairment, disability, handicap, shaken baby syndrome, and disorder of the meninges. This is just an area of the brain, subdural hematoma, epidural hematoma, subarachnoid hemorrhage, and then we've already seen meningitis. Trigeminal neuralgia is another condition of the cranial nerves. We'll do that pretty quickly. Disorders of the spinal cord and the peripheral nerves. All right, some medical terminology. These aren't conditions. These are just going to be terms that you might see. And this actually has to do with the multiple sclerosis on page, that's on page 291. So multiple sclerosis is a condition, but these are some terms that go along with multiple sclerosis. Exacerbation, intermittent, demyelination, and remission. And then we have this area has to do with like disorders of the spinal cord. So if you have a spinal cord injury or if you have actual disease, so paralysis, amyotrophic, and amyotrophic is referred to amyotrophic lateral sclerosis, spondylosis, poliomyelitis, and atrophy. Some other terms regarding to disorders of the peripheral nerves, you have neuropathy, mononeuropathy, polyneuropathy, herpes zoster, otherwise known as shingles. And the reason that shingles is in the nervous system is because the shingles rash, it actually follows along the nerve pathways. And then postherpetic neuralgia. Congenital anomalies, anencephaly, microcephaly, and hydrocephalus. And we go into other ones, fetal alcohol syndrome, meningocele, and meningomyelocele. And you can see, let's see. No, I don't have any pictures of those, but there is a picture of a baby with a spina bifida cystica in your book, and you can see the like tumor formed on the back side of the baby's buttocks. Diagnostic procedures in the nervous system or neurology. We have an electroencephalography, an electroencephalography, and so this one would be you can see electricity, and encephal is brain, and graphy process of recording. So electro, why I can't say that right now. Electroencephalography. There we go. Tongue tied again. Computed tomography, magnetic resonance imaging you can see, and then a cerebral angiography, a cerebral arteriography. So what's the difference between cerebral angiography and cerebral arteriography? You could look that up. Color Doppler ultrasonography and echoencephalography, a little bit different. Echo is different than electro. Position or positron emission tomography. This is referred to as a PET scan, myelography, and electromyography. All right, and then now we get into nervous system abbreviations. We've already talked about CSF, cerebrospinal fluid, CT, CTS, EEG, FAS, MRI, and then PET. And like I stated, that table is in the very back of the textbook. Craniotomy, cranioplasty. We have microvascular decompression, and then carotid endarterectomy. So when it comes to a glioma is just a form of brain cancer. And so some of the treatments for a glioma would be surgery, radiotherapy, otherwise some people just refer to as radiation, chemotherapy, and then brachytherapy. Pharmacology of the nervous system, you have stimulants, sedatives, inhaled anesthetics, tranquilizers, antidepressants, anti-epileptics. So now we come to where there's some root elements. So the idea is to determine the definition of these root elements. And again, some review, do whatever you want with these. But again, the idea is to look at the term, identify the prefix, the root word or combining form, and the suffix, figure out the meanings of those individual word components, and then determine the overall definition of the term. So we have narcolepsy, neuralgia, atrophy, neurologist, hemiparesis, intracranial, encephalitis, microcephaly, quadriplegia, and then some root words combining forms and prefixing suffixes, pathy, cephalo, algis, syringo, audit, trophy, myo, plege, som, angio, electromyography, myelography, electroencephalogram, angiography, anti-epileptic, and anesthetic. And that is it for chapter 9.